And gentlemen, viewers around the world, welcome to another episode of Monitor Your Health, the program where we educate the public on contemporary health situation. So today, we are going to talk about sexually transmitted diseases. My name remains Dr. Femi Ogunremi, and I have with me here in the studio Dr. Myke Isidienu. Dr. Myke Isidienu is a general practitioner in Australia. You're very much welcome, Dr. Isidenu.
Thank you, Dr. Ogunremi, and thank you for having me at your programs. I must use this opportunity to say a very great thank you and congratulations for everything you're doing to push healthcare, especially health information in Nigeria. God bless you as you do great things you're doing. I'm Dr. Myke Isidienu, and I'm a general practitioner here in Australia. I have a special interest in gynecology and practice as a GP obstetrician here in Australia. Thank you, ladies and gentlemen, for joining us this morning.
Thank you so much. So, sexually transmitted diseases. It's been the elephant in the house that we've been pushing. We're going to do. But I think it's very important for the public to know about this because it is a major issue in our society. So when we talk about sexually transmitted diseases, what do we actually mean?
Well, as the name implies, sexually transmitted diseases, or sometimes some people refer to it as sexually transmitted infections, so STDs or STIs. Both are equally being used quite commonly. But as the name implies, they are a group of mainly bacteria and viruses which can be and are mostly transmitted through sexual contact. So what that means is, even though a few of these diseases are not always transmitted by sexual contact, this group of diseases, especially the ones we are going to talk about today, are mainly transmitted through sexual contact. I mean, it's important. It's important for a series of reasons, but the most important reason why we're doing the program we're doing this morning is because some of the sexually transmitted diseases or infections are not symptomatic at the initial stage when the individual has them. So trying to educate people on the presence of these diseases, which may or may not be present at the initial stage, but then have long-term complications or implications is important. On the other hand, sometimes people have these infections without knowing exactly what it is they are dealing with. So trying to educate people to understand what the simplest forms of signs of sexually transmitted disease or infections are is important because some of them are quite easily treatable. While the ones that are not quite so easily treatable, is important that people know so that they can avoid the problem in the first place. So that's why we're having the talk this morning on sexually transmitted infections. So just to recap, it's just a group of mainly bacteria and viruses. I say mainly bacteria and viruses because things like pubic lice, for example, which is a parasite, can also be transmitted or transferred from one person to the other through sexual contact, but we leave those ones aside. But the main ones are some of the bacteria and viruses. Some of them are very common. Some of them are known to almost everybody, but some are not. So they are transferred from one person who has it to someone else who doesn't have it, and that's what they are.
So if we look a little bit deep, because we now know that there are viruses and there are bacteria and there are other organisms that will cause this particular condition. What are the if we want to get to understand what specifically are these diseases, can we just bullet them and then we just bite in from that angle?
That's a good question, Dr. Ogunremi. I mean, take, for example, one of the most or best known sexually transmitted disease is HIV, which causes AIDS. So that's a virus, human immunodeficiency virus, which can be transferred from one person to the other, mainly through sexual contact, but also through any other form of transfer of blood or bodily fluids from one person to another. The commonest of the sexually transmitted infections in most places is chlamydia, for example. So the main groups are the chlamydia, gonorrhea, syphilis, then you have hepatitis B and C, and then you have HIV, which causes AIDS. There are also the what we call human papilloma virus, or the HPV, and the herpes simplex virus, which is called, which also causes genital and oral sores in some people. So these are the main groups, and they are the ones that we will be concentrating on. I know there is a trichomonas, something that causes a problem called trichomonas vaginalis, or TV, which is also sexually transmitted, but is not as deadly. Now, what is about chlamydia that makes it very important for us to understand is that in majority of cases, chlamydia does not have any symptoms or does not show any symptoms. It does have symptoms, which we will get through to, but majority of people who have chlamydia don't even know that they have them. And so also things like gonorrhea don't know that they have them. Syphilis might come with fleeting symptoms, but then remains and continues to cause problems. HIV/AIDS is another. You can't see someone who has HIV and know immediately that they do have it. They may not have any symptoms whatsoever. It can take quite a long time before people who have HIV, for example, will then develop any noticeable symptoms that might cause them problems. And by that time, it's already too late. Things like we mentioned, the human papilloma virus, or HPV, which causes genital warts in men and women, but also is a common cause of cervical cancer. I know that you, Dr. Ogunremi, you are big in Nigeria in regards to cancer screening, especially breast and cervical cancer. HPV really doesn't have much of a symptom, but long-term, it could and has been found to be the number one in over 99% of cases cause of cervical cancer, which has become very prevalent, and which I know you've been screening very recently. So that takes us to what are the symptoms that people can have when they have some of these diseases. Well, there are different symptoms in men and women, mainly discharge. Discharge in men through the penis is one of the main symptoms. Discharge from the vagina in women is one of the other symptoms. In women, again, sometimes they can have what we call PID, or pelvic inflammatory disease. PID, or pelvic inflammatory disease, is caused mainly by things like chlamydia and gonorrhea. And this involves inflammation of the pelvic organs in the women, which includes the ovaries and the uterus, and generally present with discharge and pain, severe pain. And these can be treated, but when people are having discharge and pain and they don't understand why that is happening, well, it might be that this is the reason why it's happening. And seeing their medical practitioner for investigations might be a good way forward towards looking into that.
Right. Thank you so much. So we've talked about some of these conditions now. Obviously, we know that HIV is something that takes time for people to actually see, to even know. So people might carry this and they do not even have an idea that they're actually carrying it. And then we've talked about, chlamydia, gonorrhea, and things. So obviously you've mentioned some of these signs and symptoms, but what people be thinking is, okay, how do I even know? I do not know. I know you talked about the symptoms, but that accrued to me as an individual what do I need to know? Do I even carry any of these things now? And if I do, how do I know? How do we answer?
Well, that's a very good question, question, Dr. Ogunremi. One of the main things, we did say that for anyone to have a sexually transmitted disease, they ought to have caught it from someone who already has the disease. So if we are talking about the predispositions, or what are the things that make someone more likely to have a sexually transmitted disease, that's that's a good place to start. So, we know it's very common in young people, and by the time people have, for a whole lot of reasons. One is that young people are more, I don't want to be cliched about this, but maybe more likely to have multiple sexual partners. And multiple sex partners is one of the main things. If you're having sex with people that you don't know about, then there is a chance that you may catch the sexually transmitted infections from them. So to have a sexually transmitted disease, you ought to be sexually active. And being sexually active means that you're having sex with people. And if you're having sex with different people, then your risk of catching sexually transmitted disease increases. Also, there are some kinds of unsafe sex practices, because it's one thing saying, well, if you have sex with someone who has a sexually transmitted disease, you may catch it. But if you are not practicing unsafe sex, then you may not catch sexually transmitted disease. And what do we mean by safe sex? Well, barrier methods, condoms. If you are not sure, you must use a condom. By using a condom, the chances that you might catch the disease in the first place is low. People who are in the sex trade, by extension of the previously mentioned multiple sex partners, are also more at risk of catching sexually transmitted diseases, but also are people who are paying for sex. So if someone is paying for sex, then they're having sex with someone who is likely to be receiving money for sex, and therefore having different sexual partners on a regular basis. So we also know that is more common in men in a lot of societies where this has been studied, and that people who have post-secondary education are more at risk of having sexually transmitted diseases. Well, there is a whole range of reasons why that may be the case, but the university students should take notice. One of the commonest environments where sexually transmitted infections are spread from one person to the other. So knowing whether you have engaged in sex with someone or different people that you cannot account for is the number one red flag, as the case may be. And if that is the case with you, then knowing, again, as we mentioned already, that sometimes, quite often, there is no symptom with the disease, means that getting tested is one of the best things that you could do, especially for the common ones. On the other hand, the symptoms themselves, if you have, we talked about gonorrhea and chlamydia. These are mostly the symptom of chlamydia and gonorrhea infection is mostly discharge from the private areas. And if you have any form of discharge from the private area, then you're better off getting tested. That's not to say that every discharge from the private area, especially in women, is a sexually transmitted disease. There are things like thrush, vagina thrush, which is a discharge that has nothing to do with sexually transmitted disease. So these symptoms of discharge, pain, or a high risk from having some of the practices we mentioned, or having sexual intercourse or relations with someone that you cannot account for, mean that there is a high risk for suspicion. And getting tested is the number one way to, to find out, because you're better off finding out now than later, especially for women, but also importantly for men. When I say especially for women, we live in a society where people cherish having children. And one of the complications or long-term complications of sexually transmitted diseases, especially chlamydia, is infertility.
Right. Okay, so now that we're talking about, the complications, so apart from infertility, are there other things that we need to, as an individual, that we need to be mindful of? We're going to come back to the treatments of this in a minute, but now we'll talk about, complications. So, because that would be, why do I need to even bother, so what do we need to know?
Okay. Yes. So I've already mentioned that, some of the sexually transmitted diseases are very easily treated. Some, on the other hand, are not very easily treated. While there are some others that, even though they are not very easily treated, they can be treated to stop the individual who has any of these diseases from developing a complication that therefore cannot be treated. So I'll just divide them into these three. So chlamydia is the commonest cause of sexually transmitted disease, and chlamydia is very easily treated. Chlamydia can be treated with just a one-off dose of antibiotic, the right antibiotic. Gonorrhea can be treated with a one-off treatment of a, antibiotic injection and be very easily treated for that. But HIV cannot be treated, even though it can be treated in parts of the world where, who are richer and who can afford the medications that are used for treatment of HIV. People are no longer really dying from HIV per se. And we said people don't know they have HIV, for example, and it continues to go on until their immune system is completely suppressed. So human immunodeficiency virus is a virus which depletes the immune system. The immune system is the system in the body which comprises of cells and other organs that help us to fight day-to-day problems. If I catch a pneumonia, I may be able to fight it myself. If I have a wound on my leg, I may be able to deal with it. But what HIV does is that it depletes all of my immune system, and therefore I'm not able to fight anything on my own, and any little thing can just finish the individual off. So finding out whether someone has HIV earlier on means that it's possible also to be able to treat that. It may be very expensive to do, especially in our environment. Hepatitis B and C can be treated, but if untreated, they can lead to liver problems, chronic liver problems. And once the liver is damaged or completely damaged by the hepatitis B or C, mostly B, but now C is rising, then it may be too late for the individual to be able to kind of remedy the situation. We mentioned about cancers that are being caused by the human papilloma virus, HPV. This forms the basis of some of the screening for, it's a pre-screening for before there are actually any changes in the cervix. The cervix is the neck of the womb. And so treatment of those, or finding out those as well. Well, one of the oldest sexually transmitted diseases is syphilis. Syphilis, quite interestingly, goes through 3 stages. The initial stage where the individual feels generally unwell, as if they had a malaria or a flu or cold type symptoms. They can or may have an ulcer in the genital area, in the penis in men, and in the vagina area in the women. But ultimately, untreated, it may get to a position where it causes some neurological problems. Neurological means damages the brain and also the heart. So that's why those ones are easy to deal, important for them to be dealt with. Genital warts, which is caused by herpes simplex virus, it's a big bother. It causes these rashes in the private area, which comes and goes and causes pain, a lot of pain, and and discomfort. It affects the ability of the individual to enjoy themselves and to enjoy their lives. So that's why these ones are also important to deal with. Femi.
Thank you so much. So now that we know, I mean, obviously there are a lot of things that, you know, associated with these conditions, ranging from as simple as a rash, a discharge, and gone on to infertility, where somebody is not able to, you know, have a baby. Now, how do we get to diagnose these, you know, conditions? Or so somebody's thinking, maybe I might have this now. What are they going to do with me? Are they going to be able to find out, to confirm? Because we mentioned earlier on that all these charges are not sexually transmitted, you know, issue. Sometimes it might be as simple as thrush. Are there things that people need to be thinking about in terms of how do I get investigated?
Yes, the investigation for sexually transmitted infections or diseases is mainly threefold. One is blood test for some of them: hepatitis B, hepatitis C, HIV. Are most commonly diagnosed with taking a blood sample. It's as simple as that, sending it to the lab and then having it tested. So if the infection is there, it can be found out, and the next step can then be taken. For chlamydia and syphilis is also detected by doing a blood test. For chlamydia and hepatitis and gonorrhea, well, they can be tested either from a urine or by taking a swab from the private area of the individual. We know that the current testing regimes can very easily diagnose and very accurately diagnose chlamydia and gonorrhea. It's important that the sample is collected in the right way, either a first urine sample in the morning or after the individual has not passed urine for about 2 hours. So, you know, it can wash out the disease, and this can be tested in the lab through what we call a polymerase chain reaction, the similar type of test that is used for, you know, COVID-19 when swabs are taken. So it can be tested in that way in the urine, or it can be tested by taking a swab from a discharge. The swab is more easily taken in men if they already have a discharge. Otherwise, it can be painful and uncomfortable, and urine testing can suffice. In women, urine can be used, but in situations where there is a discharge, it's better tested with a swab test, which is just taken from the private area as well. Doctors, if someone had presented to a doctor for an assessment of their symptoms, say someone is presenting with a pelvic inflammatory disease, which we mentioned is a common cause of symptom of some sexually transmitted diseases, especially chlamydia and gonorrhea. And if that individual, especially a woman, is going to be examined by the doctor as part of determining what may be going on, the severity of it, the potential treatment that might be utilized, they can take a swab at the same time. And these swabs are very readily able to give the answers to the question. For herpes simplex virus, which causes genital conditions, genital warts, you know, when there is a lesion, or when there are the rashes that are in the genital area, swabs can be taken from them. If there is no lesion at the time, well, some types of blood tests can also say whether the person has ever had the virus, is caused by a virus, or whether they also have a current infection with the virus. But mostly taking a swab is usually the best way to figure out 100% whether this is the cause of the rash that they have or not. I do have to mention as well, you know, prevention is one of the best ways to, you know, to deal with the problems that arise from sexually transmitted diseases. And that is why you're doing what you're doing. That's why we're doing what we're doing, trying to educate the individual at an individual level, but at a societal level as well is, you know, public information, especially at schools, because once people imbibe some of these principles at a younger age, then it might be what will last them a lifetime. So prevention by use of condoms, limiting sex partners, and reducing at-risk partners is one of the things that can stop this. But for those who think they might have sexually transmitted disease, or those who want to confirm that they don't have, they should see their doctor and get tested. And contact tracing is one of the best ways to get the society free from sexually transmitted diseases. It should be a selfless service to society and to everybody. If someone were to be diagnosed with a sexually transmitted disease, it's important that if it's possible, that they should inform their previous sexual partners and, just to get them to get tested as well. And if they are still in relationship with anyone, they should also get those people tested as well.
Thank you so much, Dr. Isidenu. Now, in the next, 2-3 minutes, we need to discuss, the treatments. What are, if somebody now feels, okay, I think what I'm thinking is likely to be like, I've got myself into this hoo-ha. We talked about the fact that prevention is the best, cure. Is there anything that can be done to salvage, situation for some of these things? We have just short time now.
Okay, so we'll start with the simplest ones, chlamydia, or the commonest ones, chlamydia. Chlamydia can very easily be treated with an antibiotic. Okay, I don't think it's right on this forum to be mentioning names of antibiotics, because then people go into self-treatment and then they may treat the wrong thing, or, but it can be treated. The important thing is to understand that chlamydia can be treated with a simple antibiotic that is given just once. It's just a one-dose antibiotic. Gonorrhea can be treated with a simple injection, and is just a one injection that is then repeated once again, just to to ensure that it's all treated completely. People who have hepatitis B or C, this can be treated with medications, but it's an ongoing treatment that lasts about 6 months or thereabout, and then they're followed up again. But it's worth it, because if the liver is gone, then it's gone. For HIV, there are several issues. Well, the most important thing is to know, because then it can be treated. Treatment is not simple. It's complicated, and is a long duration treatment, but that too can also be treated. Syphilis can also be treated. It's a simple treatment with, with an antibiotic, which helps. So that is it. The viruses, which we mentioned, well, herpes simplex virus, which causes the genital wart, human papilloma virus, HPV, which can cause, genital warts themselves. They are not easily treated, but there is a reason why, especially in women, it's important that they know. Because for syphilis and genital warts, when people are having babies can drag these infections on their way out, which can cause some problems. Syphilis can cause blindness in newborn babies. And so it's important as well to understand when people have infections. I know that in the Western countries, once people are pregnant, they are screened for all sexually transmitted infections. These thousands upon thousands of tests that we do every day, just to pick 1 or 2 cases out of every, say every 200 or thereabout. And these are then, treated appropriately. And if it's something that cannot be treated, some of the viruses, then a decision is made whether the individual should have a cesarean section to deliver their babies, and whether the babies need to be tested and given some treatment shortly after they are born. So, Femi.
Thank you so much. Obviously, we've run out of our time now, but there are a few questions from the public. I just want us to answer 1 or 2 of them, and then we'll be calling a day. So, first question, says, thank you, doctor, for the information so far. How can the country address and manage young people's sexual reproductive health to reduce incidence of STD in such people? That's the number one question. And we have one that asked about what is Candida and its implication when left untreated. Is it also an STD?
Okay, I'll quickly discuss the second question. We did mention during the course of our discussion that Candida causes thrush. It causes discharge from the private areas of the individuals, especially women. And the discharge is generally thick and whitish. And one of the other symptoms that it causes is itchiness. It's not a sexually transmitted disease. It can also be very easily treated. It's usually treated either with an oral medication or with a vaginal tablet that is just inserted, or with cream, or a combination of a vaginal tablet, which is my favorite, and a cream that is used for about 5 days, and that generally treats it. So Candida causes the symptom of thick, whitish, cord-like vaginal discharge, as well as itchiness, and can very easily be treated. Regarding the what can be done about young people, it's part of why we are doing this, education. I think because we are a very religious country, sometimes we assume that if we don't talk about some things, then they don't exist, or that we can preach about some things and expect that everybody is going to listen to it and do it. Say abstinence. Sorry, I know I'm getting a bit dark. It's getting dark in Australia here, so just bear with me. So, it's the education of the young people. We give people information. Once they have the information, they will be able to determine what to do with it. And that information is that the person that you might be having sexual contact with may have a sexually transmitted infection, which you may not know about. And that if you have sexual intercourse with that person, that you may catch those infections. And sexual intercourse includes oral sex, by the way. And so the use of barrier contraception, condoms, is highly likely, and in most cases, almost 99%, except if there is an accident or something like that, to prevent any individual from catching a sexually transmitted infection. So educating people to understand that there is the existence of sexually transmitted diseases, that they may not know they have it initially, nor the person that they're having sexual relations with, who may not also know, but at long term, it can cause problems. And therefore, using prevention will help, or abstaining if you are able to, until you know that the person you're having sexual relations with is clean like yourself. On the other hand, if anyone is an at-risk person, then they should get tested, because if you test and treat someone, then that person is unlikely to transfer or transmit the disease to someone else. So that's the main thing. I think we know the government has a role to play, in all of this, because majority of schools are run by government, and therefore it should form part of the curriculum that sex education is inculcated into the general curriculum, especially at secondary school level. But also, a lot of religious groups run schools. I'm a Catholic, and I go to church every Sunday. But the fact of the matter is that people still fall by the wayside, and so preparing them for that sort of situation is important. Rather than just assuming that it's never going to happen. So some of the schools, especially high schools or secondary schools, are run by religious organizations, and there needs to be an understanding in a respectful way that some form of sex education is important and will help both the children and the society at large. Femi.
Thank you so much, Michael. It's been a pleasure having you here. We really appreciate. I can see you're getting darker, so I think it's better for us to All right. Thank you.
Okay. Right. So, yeah. Right.
So it's really nice of you to give us your time, and to the public, I want to also thank you for joining us again this episode. I believe you've learned one or two things, and don't forget, sexually transmitted diseases, they're real and they're causing real havoc. Of importance is we need to know that the topmost thing to do is barrier. Keep yourself safe. And also talk about contact tracing. Somebody's gotten it. Get the other person who you think might be, an associate, to get, tested in this case, so that they can, you can kill the umbrella once and for all, instead of, spreading the disease. Thank you so much for joining us this time, and we wish you a very good weekend, and until we see you again next week, please have a nice top of the week. And also don't forget that COVID-19 is still real, and we're having information here in Nigeria, things happening again. We're having some strains coming in, and a bit of panic here and there. Please keep yourself safe and have a nice weekend. Bye-bye.